Anyway, welcome, and thank you for taking time out of your day to dedicate to the mental health and well-being of our community. Some of what we are sharing today is going to be familiar to you, and other perspectives will be somewhat unfamiliar territory, and that is intentional. We ask that you receive this information with an open mind as you develop a big picture approach to improving the well-being of our community. We also ask that you hold all questions until after you have visited the tables of Paulding service providers here today, and we gather again to allow 30 minutes for the panel discussion. Each provider has a unique population they work with, and we hope you gain insight to their challenges and accomplishments. Your bingo card, which you will be seeing there, can be your guide to ensure you visit everyone, and we'll have a few door prizes at the end of the day. So my name is Guy Scull, and I am the co-chair of Paulding Family Connection. And let's see, Linda Verscharen is walking around. She's waving her hand back there. She is the chair of Paulding Family Connection. And Michelle Craig, please stand up. She is the coordinator of Paulding Family Connection. So also, just a little housekeeping duties here. Want to let you know that when you go out in the restrooms, you go out this door in the back here and go to your left, you'll see the restrooms. And as far as the fire extinguisher and the AED defibrillator, they're off to your left through that hallway. So right now we're going to go ahead and give an invocation here, so please bow your heads. Heavenly Father, as we come together to brainstorm and create, we ask for your divine inspiration to fill our minds and hearts. Your word says in James 1:17, every good and perfect gift is from above, coming down from the Father to the heavenly lights. We recognize that all creativity and ideas come from you, the ultimate creator, and we invite your presence to guide us as we think, share, and explore new possibilities. Lord, give us fresh perspectives and innovative ideas. Open our minds to think outside the box and empower us with the creativity to solve problems and bring new insights to the table. As Ephesians 2:10 reminds us, for we are God's handiwork, created in Christ Jesus to do good works, which God prepared in advance for us to do. Help us remember that you have created us with purpose, and part of that purpose is to use our minds and talents for your glory. Grant us unity as we collaborate, and may our ideas flow freely with respect for one another. Let us embrace the diversity of thought, knowing that you have placed unique gifts in each of us. Help us not to be limited by fear or doubt, but to trust in your guidance, believing that you will bless our efforts with creativity that goes beyond what we could imagine. We thank you for the opportunity to work together, and we trust that you will lead us to ideas that bring good to others and honor in your name. In Jesus' name we pray, amen. Okay, please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, with liberty and justice for all. Okay, so we're going to go through several slides here, and the first one is a Paulding general information from the U.S. Census Bureau. And as you can read on any one of these three screens, you can basically see that the population now of Paulding is 189,000 plus. This is an increase of 8.6% from the 2020 population, and with a growth rate of 2.41% in the past year. So it really is a up-and-coming growing county. It is the 13th most populated county in the state of Georgia out of 159 counties, with an area of 315 square miles. Unemployment rate, 3.1% as of this past October. Median household income of a little over $94,000. Average family size, 3.37. Home ownership rates of 78.9%. The house value of $300,000 to $499,999 is 55.5%. Bachelor's degree or higher, 27 or more percent. High school or equivalent degree, 31.2%, and school enrollment, K-12 grade, is 74.3%. So what is mental health? As you can read there, includes our emotional, psychological, and social well-being. It affords how we think, feel, and act. It also helps to determine how we handle stress, relate to others, and make healthy choices. Mental health is more than just the absence of mental disorders. It exists over a complex continuum which is experienced different from one person to the next, with varying degrees of difficulty and distress and potentially very different social and clinical outcomes. Mental illness is mental conditions involving changes in emotion, thinking, or behavior. For a combination of these, mental illnesses can be associated with distress and or problems functioning in social work or family activities. It's not only common about 1 every 5 adults, but it is a relatable health condition just like heart disease or diabetes. And as you can see, there is a difference between mental health and mental illness. I want you all to just be aware of that as you're reading this. What causes mental illness? There is no single cause for mental illness, or a number of factors can contribute to the risk for mental illness, such as genes and family history, life experiences, biological factors, a traumatic brain injury, a mother's exposure to viruses or toxic chemicals while pregnant, use of alcohol or drugs, having a serious medical condition like cancer, having few friends, and feeling lonely or isolated. So this next slide here, if you can see that, this families with preteen youth make up the largest population that will become the foundation of our future. Also worth noting is the age and makeup of those adults responsible for recognizing mental health issues for their children, keeping in mind that sometimes child care shifts back to the senior population as well. But as you can see from there, the largest group is the third from the bottom there, the 10 to 14 years old. And, by age and sex there. So you can see the big bump that there is right there, as well as you get up into the little higher values right there of, 16 to 18 years old, and then even higher. So it very much is not inverted a pyramid, but very much there that shows that there's going to be a pretty good increase in the number of kids coming to age and into adult age very shortly. Okay, we all know people who are ALICE. I don't know how many people here recognize the term ALICE. Can I have a show of hands who recognize what the term ALICE is? 1, 2, 3, 4. Okay. Well, ALICE is it's an acronym for Asset Limited Income Constrained Employed, earning more than the federal poverty level but not enough to afford the basics where they live. ALICE households and households in poverty are forced to make tough choices, such as deciding between quality childcare or paying the rent, choices that have long-term consequences not only for their families but for all. So while conditions have improved for some households, many continue to struggle, especially as wages fail to keep pace with the rising cost of household essentials, such as child care, food, transportation, health care, etc. And that's probably going to continue to grow as some federal programs are going to be continuing to be cut back or eliminated altogether. So I think for the folks in this room, it's going to be very important to have that knowledge of what is coming down the road here. Okay. All right, small population of adults 16 years and older in Paulding County were unemployed, and a large number were working in 2022. Labor status retired was 11.3%, not in the labor force, 22.1% for unemployed, 2.7% in 2022, grew to 3.1% for unemployed in October of 2024. And as you can see, part-time salary, 4%, part-time hourly, 10.9% of the population, full-time hourly, 24%. So full-time salary was 25%. A substantial portion of both full and part-time workers are paid by the hour. These workers are more likely to have fluctuations in income and less likely to receive benefits. Patient to clinician ratios. This is really important for Paulding County. Primary care physicians in Paulding County see an average of 6,000 934 patients per clinician. This represents a 6.89% increase from the previous year of 6,487 patients. Income affects access. Having effective access to clinical services becomes a difficult financial decision on a person that has to choose between mental health services versus living essentials. So if there's a choice between the two, you know which one's going to win. Affecting the well-being of these almost 7,000 citizens. The need for services and licensed clinical providers in our area has gone up 6.89% in the last year. Okay, so we are at 2023, the poor mental health days. The average number of mentally unhealthy days reported in a 30-day window was 4.9% in Paulding County. Frequent mental distress is the percentage of adults reporting 14 or more days of poor mental health per month, age adjusted, was 15.5%. Poor physical health, 9.4%. So obviously, poor mental health definitely impacts our workforce. The financial impact is felt by local employers as absenteeism rises when affordable mental health services are not present and basic needs cannot be met. Absenteeism is impacted by those uninsured as they delay seeking services due to cost. So as you can see from this, just about every aspect of Paulding County, whether it's a school, whether it's businesses, whether it's government agencies, whether it's individuals, families are affected by mental health. Uninsured residents under age 19. In 2023, the percentage of children under age 19 without health insurance was 7.78%. And adults under the age of 65 without health insurance was 16.9%. So as I say, this is probably going to rise because of programming being cut back in the federal level, which then affects the state level, which then affects the local level. When services are available, health insurance is often a determining factor in household budgets. Since many cannot pay out of pocket for policy premiums or high-dollar self-pay services, those individuals without coverage continues to grow, adding to the financial strain of the household, especially our senior citizens. Okay, monthly ALICE, survival budget, Social Security payments, and the federal poverty level. We are witnessing an emerging trend of grandparents, often widowed with a single income, raising their grandchildren. As shown, monthly costs for the ALICE 65 plus survival budget for one adult in Georgia were $1,130 more than the average Social Security payment and $1,624 more than the federal poverty level. So the American Community Survey estimated that 12% of the population is 65 years old and older, while the state records 15.4% in the same age range, emphasizing the gap between surviving and thriving. Paulding County Sheriff Office statistics. So the call volume in 2024, let me put back up just a second here. The total complaints were 51,958. And of that, the call volume for assault was 365, child abuse 452, domestic disturbance almost 5,000, DUI over 50, mentally ill almost 100, overdose over 60, and suicide attempt and threats 724. So the transport hours for someone in the mental health transport system there for the sheriff's office usually is a 10 to 13 hour ride either to a mental health facility. 13 is what? 10:13. Oh, I'm sorry. 10:13 is the, where's Ashley? He should have reminded me of that. 10:13 is the call. It's a 38 was the transport hours, and for substance abuse, the transport hours was 144. So that obviously increases the budget for the sheriff's department. Mental health for the incarcerated. Difficulty on calls that may originate as domestic, but upon arrival become a mental health or substance use concern. County-to-county transfers often cause challenges to medications. We also see that referrals or services provided at discharge are often difficult to access because those services are usually outside of the Paulding area. Transportation is not always available. Now, interestingly, the Paulding County Jail is a 631-bed facility that houses individuals both prior to them being sentenced and after they are sentenced. The GBPI, the Georgia Budget and Policy Institute, reports that over the last 20 years, the cost of running Georgia's prisons have risen by almost 70%. Georgia's Department of Corrections budget for fiscal 25 is $1.5 billion, billion with a B. This year's budget continues a 3-year trend in prison spending. This increase is driven by efforts to improve employee retention through pay raises and to address increased spending on health care contracts in response to issues such as rising prison violence, chronic health needs, and an aging incarcerated population. The expense continues when you look at the extended court costs. Mental health in Paulding County courts. The district attorney leads a team of prosecuting attorneys, investigators, victim advocates, and support personnel. Paulding County Superior Court led program Paulding County Parental Accountability Court. They also have the Paulding County Drug Court, the Paulding County Mental Health Court, and the Paulding County Juvenile Court. Law enforcement has their role. However, additional interventions are needed. Youth and adults may find themselves being guided by one of the many departments of the judicial system. Each division is able to focus on a specialized sector that is unique to that individual. We have only highlighted those today that have the most relevance to mental health. Highlight examples are the services on these particular ones that we've just talked about. These services do have a long-term cost on taxpayers. At one time, it was calculated that a thriving adult contributes $30,000 to $40,000 a year when returned to society as a productive citizen. And then we have the substance use and mental health among teens. So substance usage, this is from the Georgia Student Health Survey, 2015 to 2022. 10,286 students, 6th to 12th grade, reported in the last 30 days. As you can see, the substance usage, alcohol has gone from 8.8% down to 7.1%. Marijuana usage was down. Meth was up from 1.6 to 2.5%. Heroin up. Painkillers up. Sedatives up. So out of the mental health reported, out of the controlled behavior of 12.3 to 12.2%. Panic went up from 27.8 to 33%. Sadness or withdrawal went down just a little bit. Self-harm went up a little bit. Self-harm ideation went up from 13.2 to 15.6%, and suicide attempt 9.2 to 10.9%, with suicide ideation 4.4 to 5.4%. With attention to the well-being and reform of our adult role models in the home, we can then assist in creating an environment that has positive influence on our youth, many of whom have returned to substance use as a coping mechanism and attempt to self-medicate. So, opioid use disorder continuum of care. Region 1, which we are in, January 2018 to 22. Region 1 experiences higher numbers of opioid overdose deaths and opioid-related ED visits, consistent with the county's population that borders Atlanta, compared to more rural regions in the state overall. Paulding County ranks fourth in OUD deaths and fifth in naloxone. Is that how I'm pronouncing it? Narcan. Okay, Narcan. Administration. Opioid overdose death rates above the regional average, and BHSS provider rates below our regional average. Across Region 1, there does not appear to be an association between the number of behavioral health and social services providers and opioid ED visits. Many of the OUD, SUD continuum of care providers are currently concentrated around downtown Atlanta, with fewer providers in the eastern half of Region 1. The opioids are still very present in our community. Resources are still lacking in Paulding and expected to grow as the need will continue to climb. So here are many of the resources that can be found in Paulding County. A good foundation to work with together to address substance use and recovery, but a valuable resource for addictive disease support in Paulding is Highland Rivers. So we have here the next one, Paulding County, with regards to services provided in Paulding County, outpatient mental health and substance use treatment and recovery services for adults and youth, community support services, addictive disease support services, assertive community treatment, and it goes on as you can read right there. So Highland Rivers Behavioral Health has one clinic in Paulding, 23 on staff. Paulding residents served by Highland Rivers in FY25 is a very large 1,093. Number of services delivered in Paulding is 13,708 with a value of over $1,200,000. So Highland Rivers holds the DBHDD state contract as our CSB provider. These services cover a wide variety of demographics as reported by HRBH. So here's another slide here of services, individuals served by diagnosis. Mental health only, over 8,000, almost 8,500. Substance abuse, 1,742. Disability services only, 231. Mental health and substance abuse together, 5,818. Mental health and IDD, 337. Substance use and IDD, 3. And MHSU and IDD, 32. Taken from the Highland Rivers Behavioral Health FY24 annual report is a summary of the individuals served by diagnosis. Veteran services by Highland Rivers. Veterans served, 484. Number of services provided to veterans, 6,303. Investment in services to veterans, $329,280. And percentage of services to veterans paid by CSC, 65.3. So they provide individual, group, and family counseling for PTSD, family and couples counseling, medication assessments, crisis intervention and stabilization, case management, supported employment, outpatient and residential substance use recovery, connections to community resources. They also serve veterans regardless of discharge status or ability to pay, providing veteran-specific counseling groups and the Staff Sergeant Fox Suicide Prevention Program funded by a grant from the VA. Mental health and education. There is currently quite a bit of legislative focus on mental health in the state that has to be addressed after the school shooting in Winder. Many counties, including Paulding, offered aid to Barrow County in the wake of this tragedy as the anticipated need for SBT jumps in situations like this. In Paulding, we have increased access to services for students by partnering with private practices like Tranquil Life Counseling Center, expanding beyond the basic APEX programs with Highland Rivers and the Northup Connection. From 2023 to 2024, these numbers reflect total number of school-based therapy sessions through the end of December 2024. When a student meets with a counselor, they are immediately assessed using the Columbia Suicide Severity Rating Scales. As you can see how much has jumped from 2022-23 to 23-24, and now 24-25. Private practice and partnership in education. From the school system, this is the total number of Columbia Suicide Severity Rating Scales completed at each grade level during the listed school years. This assessment is designed to evaluate the risk of self-harm and suicidal ideation in an individual in order to determine the severity and immediacy of the risk in order to determine the level of support needed for that individual. Referrals are then made to the appropriate practitioners, often based on insurance coverage for that student, which is why partnerships are so valuable, I should say. Mental health and private practice. One of the growing partnerships is with Tranquil Life in the school system. Tranquil Life Counseling Center has almost double the amount of high-quality clinicians to increase the flexibility of scheduling and availability of appointments. There is a growing need all across the state for qualified clinicians, and you can see from 2019 to 2020, almost 2024, the increase in clinicians. Total sessions at the Tranquil Life Counseling Center. Tranquil Life Counseling Center has been able to employ highly qualified staff and continues to grow and serve our community. Their latest location here in Dallas just opened early in December 2024. Not only does this increase the number of families able to receive services in a timely fashion, having qualified staff is a key factor the state looks at while discussing state funding expansion. Medicaid expansion. This is interesting. Currently, Georgia funds 22 CSB's community service boards, serving over 120,000 adults. 1 in 4 Georgians have a behavioral health condition. Expansion to uninsured Georgians causes 90% of the financial burden on the federal level. Medicaid expansion is one example of funding determination. As funded under the Adult Mental Health Services line on Georgia State FY25 budget, the department provides evaluation, treatment, crisis, stabilization, and residential treatment for adults living with mental health conditions. Over the past decade, adult mental health services have on average accounted for about 37% of the department's state general funds. Most of these services are provided to individuals who lack access to health care coverage, and the state largely assumes that cost. CSB is facing consolidation, seems to be moving forward. Impact would be the number of available beds and impact on facility funding. These are important changes to include in a county-wide strategy. And just on the news today, I believe that the state legislature was asking, well, there was a bill, I think, proposing to bring in more people into the Medicaid system, and Governor Kemp has said no, that they're not going to be doing that. Okay, taking all these components of service into account, you can see why this requires large-scale coordination. So please use the next 30 minutes to meet some of the providers that are currently serving Paulding families. And so use the bingo card on your program to guide you to visit each provider's table. Be sure they initial on their logo before moving on to the table. For those completed all squares, take your card to the sign-in table to be entered in the drawing. You have 30 minutes total to discuss and circulate and each agency, and return your table for the Q&A. And there's prizes involved in the first 4 who complete their bingo card entirely. There we go. Okay, first one on my left here is Sheriff Ashley Henson. On Tuesday, November 5th, 2024, Ashley Henson was elected as the 50th Sheriff of Paulding County. He is a good round of applause, that's right. Ashley is a recent graduate of the Esteemed Leadership Georgia program for 2023. He retired from the SWAT team in March of 2023 with 11 years of service. And in November of 2022, he completed his final class and achieved the coveted post-SWAT officer certification. Ashley completed more than 500 hours of training just for this certification, and at the time he obtained it, he was only one of 10 people to have ever achieved this certification in the entire state of Georgia. Wow. You're welcome. So next we have, out of order here, okay. I can deal with it, that's fine. We have Misty Cooksey, is the Executive Director of Student Supports for the Paulding County School District. She has been with the district for 28 years as a teacher, assistant principal, high school principal, and now a district administrator. Her current role encompasses wraparound supports for our students, which includes school counselors, school social workers, behavior intervention, mental health, and social emotional supports. And if that's not enough, she'll go ahead and do whatever you need for her to do at your house, right? Yeah. Okay, next to Mitzi, we have District Attorney Mr. Robert Lane. On September 3rd, 2024, Governor Brian Kemp appointed and administered the oath of office to Robert S. Lane, who will serve as the 5th District Attorney for the Paulding Judicial Circuit. Prior to Mr. Lane's appointment, he served as a Senior Assistant District Attorney for the Paulding Judicial Circuit and the District Attorney Designate in charge of the Paulding Circuit Mental Health Court Program and Paulding Circuit Civil Asset Forfeiture Program. Before his service with the District Attorney's Office, Mr. Lane served as the Deputy Executive Director and General Counsel for the Georgia State Ethics Commission, where he oversaw the enforcement of the state's Campaign Finance Act and the prosecution of political and financial crimes. Paulding will be well served by his nearly 17 years of experience in the legal profession, including service as a staff attorney for Paulding Superior Court Judges Kenneth G. Vinson and James R. Osborne, and in private practice with the firm Hendrickson and Sarabutra in Dallas before joining the District Attorney's Office.
That was written by the Governor's Office. That's not my official title.
Next in line there is Tony Moon. Tony Moon is a dedicated leader, advocate, and person in long-term recovery, celebrating over 29 years free from mind and mood-altering substances. Congratulations. Tony is deeply committed to serving his community and fostering recovery initiatives. He is the executive. Let's see, where am I going next? I did. See, when you all get out of order here. Oh, here we go. He is the executive director and founder of Rising Sun Recovery, where he focuses on empowering individuals to overcome challenges and achieve lasting recovery. Tony also serves as the board president of the Paulding RCO, which is the recovery community organization, leading efforts to support and uplift those in recovery in the Paulding County community. As a certified addiction recovery peer and recovery coach, Tony brings experience and professional training to his work, offering compassionate guidance and mentorship to those on their recovery journey. In addition to his recovery work, Tony has served his country with distinction for over 3 decades. He is a senior officer of the Georgia Army National Guard and a federal employee with the Defense Contract Management Agency, embodying a lifelong commitment to service and leadership. His personal journey and professional achievements reflect his passion for recovery, community service, and making a lasting impact on others. Last, but certainly not least, is Jessica Collins, is the owner and clinical director of Tranquil Life Counseling Center. She has been working with individuals, couples, families, and groups for over 16 years as a teacher, case manager, skills trainer, and counselor to help others learn to cope with their challenges and obstacles. So now that has taken so much time, we're going to just say thanks for coming today, and we'll see you next time around. No. So anyway, right now we're going to be asking the audience here for questions, and Linda Verschert is going to be going around the room as Oprah.
Yes. All right, if you have a question, raise your hand and I will come to you, and if you'll just let us know who you would like the question to be directed, we will get started. Who's going to be the first?
Hey family, my name is Barbie Meadows. I'm with the RCO and RSR. I was just curious, taking Sheriff Ashley. Just curious because I was seeing the numbers and the gap between getting services to people. I was curious how the RCO could actually partner with y'all to provide transportation to help these people get the services they need. Because I know the more that's incarcerated, the more comes out of our pocket. I know the more the people in recovery, the more that goes into economic community.
Right. So as far as transportation, unfortunately, we're not going to be able to partner with anybody with inmates. Our inmates are going to, if they're in our custody, they can't be transported by anybody else. So we do have a transport division, and they do take inmates to and from wherever they need to go. but we can't allow our incarcerated inmates to be able to be transported by an outside entity. Now, if they're out in the world and they need transport, certainly that might be a good option, but while they're in our custody, we can't allow anybody to be transported.
I may or may not have participated in backseat rides with the county, not this county, praise the Lord, but I was just curious. I was talking about like maybe some of the people that some of the homeless people and stuff that we have in the streets right now. If y'all are coming hand to hand with them, because y'all are the point of entry, right? How could we partner with y'all at that to help provide services? I don't want to transport your prisoners, sir.
Okay.
So to help
I think that's
with
what you
the
mean.
resources, if you get a call maybe on somebody and you don't need to pick them up, and they could potentially be a resource, I think is what.
Right, so yeah, that would be outstanding. If we had a resource in the community, if we encounter someone who's in need, because we don't have the bandwidth, we don't have the manpower to be able to haul someone all over the world. So if we had a resource out there that we could call for someone who's in need, that'd be great. We would love to partner with someone that could help our folks. Like we identify the need with an individual to be able to partner with an entity that could take that individual wherever they might need to go. That would be great.
Well, let's collaborate then.
Yeah, absolutely.
On your tables, you're going to see the business cards, and part of one of the things we've been doing in preparation for the symposium is updating our resource guide and making it much easier to access, much more searchable. There's a QR code on those Paulding Family Connection cards, and those can be given out if you find somebody in need, whether it's housing, mental health, transportation, recovery resources. All of those are available. If your organization is not included, we're happy to update and include your organization in that resource guide too.
Thank you, Jessica.
Good point. For those that have been here for 100 years like me, it's the old Bible that we used to call it, the old paper resource guide. Well, those just got too costly to print, and now everybody does them online. So it's great because you can just go in and print off whatever pages you need to hand out and give it to your client or patient or whatever. All right, who has another question? Keep them coming. I need my steps in today. Nobody has any
Well, I have one for the panel here.
Go ahead.
And each one of y'all can answer this too, with regards to the federal program here to deport basically those who are illegal immigrants. What plans do you all have in this county to support that, or to go ahead and deal with that influx of law enforcement, for instance, and also for perhaps the mental health needs that are going to be mandated by this dictate?
So I've got a mic so I can start. So we've had this question a couple times in regards to the things you're seeing on the news nationally and locally. Thus far in Paulding County, we have not seen any kind of, we have not been contacted, I guess I should say, by ICE or anyone from the federal government about coming to do any kind of these sting operations or anything like that. But as I understand it, the individuals that are being arrested as a result of these operations, these are people that we don't want in our communities. And so these are not just an individual that's a migrant worker who's maybe an agricultural migrant worker that's just here illegally. These are people who have committed crimes, as I understand it. So we have not been contacted by anyone yet. But if there are people who are serious criminals, we will assist them, if need be, to apprehend serious criminals. We're not going around looking for someone who's here illegally and they've committed no crimes, just to have them arrested. And I don't think that's what's happening. I think the people that you're seeing that are being arrested, these people have committed serious crimes. These are folks that are criminals that don't need to be here or they need to be incarcerated. So that's kind of where we are with it as of now.
So as far as the school district, we will always follow the letter of the law as it is set forth. That being said, we do hope that we are not in this situation. Obviously, we want school to be a safe place for all of our students and to provide safety and security and for them to be comfortable there. So I hope that we do not wind up in the experience of having to deal with that situation. That being said, if it does happen, we will work in conjunction with the Sheriff's Department to follow the letter of the law.
thankfully for us, illegal migrants that are going to come in contact with the state judicial system are going to be criminals outside of federal immigration law. Because the sheriff doesn't enforce federal immigration law, the district attorney's office doesn't enforce federal immigration law. If we are interacting with someone, they have broken a state law, whether it be murder, robbery, rape, speeding, it's going to be something of one of those natures. And our county has always followed immigration detainers issued by both Republican and Democratic administrations. So that's not changing. There's not really going to be that big of a change we notice on our end in enforcing the laws of the state of Georgia. As far as federal policy and immigration policy, we don't touch it because it's outside of our wheelhouse. We took an oath to support and defend the state constitution of Georgia, and mine has a weirder part on that one where I promise to effectuate the duties of my office without fear, favor, or affection. So if it's not within my wheelhouse, I don't have to go address it because, well, frankly, I can't change it one way or the other. So I know there's a lot of hyperbole in our politics these days. I am a weird politician in that I governed politicians for 10 years, so I got really blunt. So forgive me if I start airing dirty laundry. And I just kind of tell it like it is. So that's my little disclaimer for any other questions that come along. But that's how we're going to deal with immigration issues.
Well, within the recovery community, we haven't seen anything, I haven't heard anything that people right now that are starting to deal with it. As far as, there's anxiety, I think a lot of people have, there's a lot of uncertainty. But within our RCO's perspective, we just kind of help people who have problems and need help. So right now, we haven't seen an influx that people are, and there's anxiety, general anxiety, because there's the fear of the unknown. But as far as us right now, we haven't had any interaction with any immigration issues.
I would say in our practice too, we really haven't seen anything specifically related to deportation outside of that fear previous to this administration. So it hasn't really affected our practice at all.
Okay.
And just out of curiosity, just a follow-up question, just out of curiosity. And I understand, and depending on what you hear, that Atlanta is one of 3 or 4 cities in the nation that they're targeting, like Chicago and New York, Atlanta. Now, if they were to start targeting Atlanta, and you had an influx, let's say, from Atlanta of these illegal migrants, people coming into Paulding County, is there any concern of that, or is it just something that it's just a scare tactic that's out there that's not really going to materialize for folks in Paulding?
For us at the sheriff's office, whether we have illegal migrants out here or not, we're going to do our job the same as if we would any other day. So if there's an influx and there's crimes committed, then we'll combat those crimes with all the resources we need to. We don't have any fear of any of that type of activity happening out here. Fortunately, we live in a great place. We have a great community, a great county, and relatively crime-free, comparatively speaking.
And this question is from Mitzi. If the case were to occur, where they now said they can go to churches and schools, you have the number of resources you would need in order to go ahead and prepare students for post entry into the schools.
So again, I will start by saying, Lord help, I hope we do not ever have to deal with that, first and foremost. My entire career has been spent supporting students. So the trauma that would very likely follow from an incident like that would be devastating. That being said, absolutely, we have a crisis team at the district level, and if we had a school where that occurred, we would have extra manpower in place to be able to work with our teachers, our students, and our parents if need be, to deal with the trauma that may come post that.
Hi, everybody. So I think that the elephant in the room is always funding. It's always money. And so we've got you all that are experts, subject matter experts at dealing with what you do. And then you've got all these community resources sitting here staring at you like, we need your help financially. And so my question is, for Paulding County to be sustainable, is there anybody at an administrative level that's able to write for these grants that are being funded by, Department of Justice, for instance, and only the only eligible entities are state and local governments that are able to actually procure this funding. But you're busy arresting folks, and you're busy prosecuting them, and you're busy telling them that mommy and daddy will be home from jail soon. And you're busy saying, hey, you need a 12-step meeting so you don't go back to jail, and then you're just cradling everybody. Is there anybody in the administration, is there a single point of contact? If we write the proposal, will you all, submit the proposal? How can we collaborate with Paulding County as an official government body to be able to tap into these resources that are just floating by and we're not grasping onto it?
I think one of the things that has really come about in the last few years is the partnerships that we've developed. So my practice, Tranquil Life, has partnered with the Paulding County Mental Health Court. We partnered with the CAC. We partnered with the RCO, with Rising Sun. And I think forums like this, where we can network and we can meet each other and we can develop those relationships, have really led to ongoing partnerships of, we've been contacted by the Sheriff's Department grant writer that was like, hey, we're putting in for a grant, what would that look like? And I think that's one of the best things that we can do is finding these forums where we can connect with the providers and the legislatures and all of the different organizations and making those connections. And one of the things I enjoy is making connections amongst the people that I've met, because this person might be looking for one particular service. I know that this other organization provides that service. And I think that's one of the things that we hope to do today, was to bring all of these different providers, legislators, elected officials together in one spot to work together.
Yeah, I'll echo what Jessica just said. So I live by this, but your network is your net worth. And so having a room of connected people like we have right now is vitally important. So whatever we can do to work together is what we need to do to make sure our community has everything they need for, educating our kids, keeping our adults who have mental health issues or substance abuse issues. All those things, we need to work together and make sure we have all the resources out there. The county does have a grant writer. Matter of fact, we've just been awarded a Bureau of Justice Assistance grant for a little north of $500,000 for body cameras. And so we're in the process of trying to find a vendor and do all the things. But we get grants all the time, not necessarily for mental health, but for other things that we need. The sheriff's office, I know the DA's office probably gets grants, but we do have a grant writer that works out of the finance department within the county government. So we do have that resource at the county level.
So it's now official, so I can actually say it. So the Paulding RCO got awarded money from the opioid settlement grant. And what that means is that we're going to have, we had about $500,000 that was given to us as an organization over the next couple of years. Well, it's one year apart, so we're going to be able to provide full-time services for peer support, which means we're specifically what was it was targeted was transitional age youth, which is your teenagers, your 14 to 26-year-olds that are critical right now. There is as we just saw in the reports. So that's what has been funded. There's additional opioid money different out there right now. So we really fall into Region 1. And there was a regional advisory committee that was appointed by the governor to decide how those funds through VBHD was the overall person in charge, and you had Georgia Council for Recovery, was also had a seat, a person in peer, as well as doctors and other folks to oversee this money. This money is expected to anywhere from 10 to 15 years be dispersed. Each county, I believe the city and the county has access to their specific funds. But for us, we got awarded that. And one of the things that we're finding in this process of the federal grants is, because the opioid money is separate, the federal grants is they're looking to fund collaborative efforts, not just one organization, not just one, so different, that's like the HRSA grant, which is rural. Unfortunately, Paulding County, we have half the county that is around Cobb, Cherokee and Douglas for the populated areas, and we have a large portion that is in rural Paulding County. But Paulding County is not considered rural. It's not in that category, so for funding purposes. So there's a lot of opportunities, but it does come down to collaborative efforts, especially when it deals with mental health. I've talked to a couple other folks that are doing it, and it's collaborative efforts, not just one agency or whatnot, but also a lot of the federal money has to be initiated at the county or the state level. So there is money out there right now, but we as organizations, we as networks, need to come together as well with the counties to be able to decide, hey, how do we want to go after, or do we have the capacity to ask for some of those grants?
Anyone else on the panel?
Well, I promised I'd hear some dirty laundry, so here we go.
There we go.
The truth be told is we've done great collaboration, and I agree with Jessica on that. I think we've really reached a point where we're going to go as far as we're going to go with a bunch of competing groups fighting over the same kind of pot of money without more enhanced cooperation. And that's just to be brutally honest. Additionally, I agree with Tony's point that we really are where the country meets the city, and we get the worst of both worlds. We get city crime and country budgets. And truth be told, I'm even talking with our legislative delegation. How many of y'all think the starting salary for my assistant district attorneys who went to school for 7 years and got a doctorate and spent $175,000 to get that degree, how many of you think that their salary starts above $75,000 a year? Raise your hand. Yeah. How many of you think it's above $70,000? The starting salary for an ADA was $65,000 a year. So literally a lot of the Alice individuals in the courthouse, aside from people coming in because they've been subpoenaed, are my lawyers. I'm having trouble getting good and qualified people to fill my office because you can't pay them to live because they've got to make the monthly loan, payment, the loan forgiveness program. It's a joke. I'm not going into political things of is it good or bad, but their monthly payment's $600 a month. They're not making enough to meet it. So it's great to say I have this resource and I can pour money into like co-responder, but if I don't have an attorney just to handle the regular case, I don't have someone to send to mental health court. Out of our entire state, there are 51 district attorneys because not every county has its own DA's office, some share. Like Haralson County has Haralson. Out of that 51 DAs, there's only one district attorney that participates weekly in their accountability court programs, and it's me. And we work, but that's not just to toot my own horn, because we also have the only public defender who does it as well, Mr. Michael Syra up here. And that's just to give you an example of we don't have the funding to properly staff it. You have your chief attorneys for both defense and the state going to work those programs because we believe in them and we see what good they can do. So we're going to need your help in getting the funding for both of our employees, because if you don't know, the assistant public defenders are just as poorly paid as the ABAs. They're now equally poorly paid now that we have parity, but it's
Only you and I have parities. The rest of them don't.
they're paid a little bit better because they can take conflict cases, but that's an argument for another day. But there is plenty of money out there, but it's only going to work if you can get elected officials in a room to better coordinate. Because the other thing I've noticed in doing this for several years is we're reaching bottlenecks. For example, in our mental health court program, I know that we have a pot of money for surveillance, but we're not able to, transportation, and we're not able to effectively use it, and we're losing the money because we don't either have a participant who needs it, and we don't have the ability to further move it. And what I'm seeing is someone's coming to me saying, I've gotten this grant, I have all of this money, how do we shoehorn it into something to make it work? Whereas what we need to do is build the program and then find the funding to fund it so it does work and we don't have these weird bottlenecks and real bad inefficiency. And I think that's just part of the growing pains of being the 13th largest county. Maybe if we get to number 12, we won't be lucky 13 and things will be a little easier. But that's my hope.
Anybody else on the panel? If not, I have a question to see. You want to go for it?
I was going to say everybody else answered, but in reality, I'm kind of mimicking what they said. As the school district, our goal is always to partner with our community. We have I think over the last few years, strengthened those partnerships with Family Alliance, with Tranquil Life. Tony and I spoke today, we're looking at what we can do on that aspect. So it's an ongoing growth of partnership of tying together our community needs in order to support our students, but in many cases to support our families so they can in turn support their students as well. Thank you.
I know it all boils down to money, but I'm gonna put Ashley on the spot. I know you get a lot of frequent flyers coming in, pick them up, take them to Wellstar, hold them for 72 hours, put them back out. 2 weeks later, you get the same thing all over again. I know a lot of other counties are having a mental health person. I don't know, but I'm sure there's a name for it. It will go with an officer. Is there anything in the budget to have someone that can assess some of these folks to kind of relieve the officer coming in, but also maybe address mental health? And I'm sure, it's like you said, it's all about the money. So I was just, sorry to put you on the spot, but.
Yeah, so obviously it's an issue that happens every single week. We have a lot of, like you said, frequent flyers. And so that makes our job very difficult every day because we don't need half the people probably that are in our jails. Maybe not half, but a vast majority of the people that are in our jail don't need to be in our jail. They need to be in a facility where they can get the proper treatment. We don't have the bandwidth, we don't have the ability, we don't have the money, we don't have the resources, the people, all the things. We don't have all the things we need to be able to properly treat these folks. Jails are not mental health facilities. And so years ago, the state had many mental health facilities, and for whatever reason, they shut a lot of those down. And so I think that's one of the reasons you see an influx in the homeless population, not only here, but just everywhere, because there's nowhere for these folks to go. And, you know, a lot of these folks will tell you they commit crimes so they can have a warm place to sleep and have food, and they can get their medications. You know, we partner with Highland Rivers. We have someone that comes to our facility every day. They spend about 40 hours a week at our facility. They help assess some of our inmates and try to get them some resources and assistance they need. But would it be helpful to have someone all the time? Absolutely. But it's a budgeting thing. Really just to kind of get deeper into the issue, they really don't need to be in our facility. And I think that's the bigger issue, is that they don't need to be in jail. Every county, most every county's got a mental health facility. You know that, right? It's called the jail. And so it's unfortunate because there's a lot of folks that are in our facilities that don't need to be. Now, they committed a crime, but they probably committed that crime because they didn't have any other opportunity for anything, whether it's hunger, whether it's warmth, whatever the situation might be. They're in there because of whatever the reason is. And so, not just me, but sheriffs all over the state have been reaching out to our state leadership to try to get some of these mental health facilities back open so these folks can get some resources that they might need. Because we don't have the bandwidth, we don't have the manpower. Our deputies, our jailers, they're not equipped to treat someone who's in mental health crisis. We do the best we can with what we got. One of the things that we're trying to do, and I want to make it mandatory for all of our jailers and deputies, is to get crisis intervention team training. I don't know if y'all are familiar with that. It's a 40-hour course. I've had it. It's a very good class. But that's something that I want every one of our men and women to have, because it gives you a better understanding of how to deal with someone who's in a crisis, whether it's autism, whether it's schizophrenia, whether it's any of the other mental illnesses that are out there. It gives that deputy or that jailer more training to be able to deal with that situation. And if you have someone who's in a crisis situation, they don't go, maybe they can recognize that a little sooner and maybe not go to a use of force type situation. Maybe they can go to more of a, hey, let's talk about this, let's give this person some space. If it's someone with autism, maybe back up, give them some space, let them, maybe they've got echolalia or whatever their issue is. Give them an opportunity to take some time with that individual and try to get them a resource that could help them, because jail is probably not the resource that they need. But we would love to have someone like that. But like you said, it's all about the dollars and cents, and at the end of the day, we can only work within the parameters of the budget that we have.
Another issue we would find even if we had the budget is finding a qualified person that would take the job. There is a nationwide shortage post-COVID of not only psychiatrists but mental health providers. I have a large practice unintentionally, but even we struggle at times to find providers, and we find them because I pay them a lot of money. Because as a business owner, I don't care about making the money, I care about providing the service, and not all business owners go that direction. Not all businesses have the funding to be able to do that. We currently have about 42 providers because we just hired a bunch. Our wait list just got down to 2 to 3 weeks. It's been 10 to 12 weeks. We have consistently had about 185 to 200 people on our regular wait list, an additional 50 plus on our school wait list. Speaking of lawyers going to school, mental health school, very expensive, doesn't pay well. No loan forgiveness, not a thing. And after graduate school, so after your bachelor's, after graduate, then you work under supervision for several more years before you can even become individually licensed. That whole process is extremely expensive. One of the largest schools in the state that was training out counselors shut down. So we have less places to go to school, less providers, and a lot of providers got burnt out in COVID, and they just left the profession altogether. So there's just literally not enough providers to go around. We were able to track down about 80 to 90 providers in Paulding County that provide in-person services for the 190,000 people.
So we want to be able to get everybody out here on time. I think Michelle has a few wrap up. Plus we want to give out some gifts. But I want to say that I personally appreciate y'all being here. Mary and I were talking, we've been working in our profession in this county for 30 years this year. So we've seen a lot come and go. Appreciate our panel members being here. This is not the end of this discussion. Please do not let this be the end. Michelle and Guy and the Mental Health Initiative has been working tirelessly for 2 years to even get to this point. This is just the first, the symposium. We kept it small on purpose so that we could educate the people who needed to be here. It's going to continue to move on. There'll be town hall meetings. These types of discussions will be expanded. So please don't let this be your one and only. The collaboration, which we've heard, is the key. I think sometimes Michelle feels like she's banging her head against the wall. Don't let her do that. Please come to our meetings. We meet regularly. That is the best way to be kept informed. If you want to be part of the Mental Health Initiative, you can contact Jessica or Guy or Michelle or myself. Be happy to give you more information on that. But it's a crisis, and we can't just come and sit and chit-chat and network and then not. And I know I'm preaching to the choir, but thank you. I'll get off my soapbox now.
Thank you, Linda. Just want to say thank you to Sheriff Henson and Betsy Cooksey and District Attorney Lane, Tony Moon, and Jessica Collins for taking time out of their day today to be with us and asking and answering some questions that the panel has, that the audience has. So thank you so much for being here today. So let's give them a nice round of applause. So we're going to be drawing some names here.
Alexandra, Hope Harbor Wellness.
Oh, Alexandra from Hope Harbor Wellness. She's still here?
Did you say Mary?
Huh?
Did you say Mary? No.
Alexandra.
Mary Alexandra?
No.
Hope Harbor.
Hope Harbor Wellness.
She may have stepped out.
Okay. Sam Sabaka. We won't even ask you to do a speech here. So.
Thank you. No one would want that.
Yeah. Sherry Davis. Is this the last one?
One more.
Steve Grimsley.
Thank you. Okay, two more.
Deidre Alexander. He stepped out. Okay. Clint Langford. Yeah. Okay. See what?
Who won the tickets, the free tickets to the Family Alliance dinner dance? You? Okay, well, I'll see you after.
Not to take them back, but just to see you. Okay, so when Paulding Family Connection put together the mental health initiative about a year and a half ago, it was designed to allow all decision-making agencies representing many diverse demographics a safe place to work together and formulate a 3-year and a 5-year plan to address mental health concerns and to organize solutions that prevented duplication of efforts and reducing the likelihood of fragmented results. We look forward to your participation in this effort as results of today's discussion are brought together and the next event planning begins. And I think that, where did she go? Linda? Yes. Oh, there you are. I think that Linda said it very well beforehand, is that we need your help. We want to go ahead and continue with this initiative. We just don't want to talk about it once or twice and then like a symposium and then let it go. This is too important for the county. This is too important for the residents here, for the businesses, for the entire, anyone you can think of in this particular county. So we're going to continue with this. And again, sometime in the springtime, not next month, Michelle, not next month, we're going to go ahead and compile all of this together and then come back with you all and have another symposium. So please keep us in your prayers, please keep us in your hearts, and please keep us in your minds as we proceed forward here. Lastly, I just want to say thanks to Greystone Power as acting as a host here. We really appreciate them doing that in such a nice facility, and to AmeriGroup for providing refreshments. So thank you. And have a good trip home, safe trip home, and we'll see you again soon.